And we need to replace this with medical liability reform, cross-state purchases, health and wellness initiatives and incentives, and there are a whole myriad of things. Deal with health care reform as a process, not one big deal that's jammed through with Cornhusker kickbacks and all kinds of other shady deals.
Mr. Towne.
Sure. What Mr. Dent has failed to mention that he also supports H.R. 5424, which will put in place the Reform Americans Can Afford Act. And the whole thing is that what this will do is it will establish universal access programs that are very similar in place to what's currently put in place by the Democrats, and it will be usurping state sovereignty with the use of taxpayer money to provide corrupt state innovation programs. Again, Congress, and whether it's Republicans or Democrats, what they are not addressing is the state-sponsored healthcare insurance cartels. And this has been going on for quite some time, since the HMO Act in 1973. I agree that what we do need to remove is the individual mandate that every citizen must purchase insurance from the government, and I object to also changes in the labor laws that will devastate the poor and the middle class. I support market-based reforms such as tax relief legislation, removal of state portability barriers, a sound currency, tort reform, and removal of the very expensive state mandates which control 15 to 40% of our premiums. Thank you.
Mr. Callahan.
I think this is another example of where Charlie Dent has failed us. He went to Washington in 2004 and he said that health care would be issue one for him. That's what Congressman Dent said 6 years ago. And he's done nothing. It's a lot of talk and very little in the way of results and very little in the way of actions. Healthcare premiums have risen since 2000 by 129%. They've risen since he got into Congress by 34%. You all know that. You all know that the current system was unsustainable, both for employers and for individuals. Something had to be done, and Charlie Dent refused to take any action. And whether it's transportation funding, he sits on the transportation committee. He talks about process. He talks about all the things that we should do. He's been there for 6 years. What has he done? When is he going to take accountability for his record? Near as I can tell, Charlie's taken their money, $400,000 of health insurance company monies. He's done nothing to improve the healthcare system in the time that he's been in Congress. I will do better.